So we know that we have high improvement in the clinical outcome in ovarian cancer, and despite better surgery, better chemotherapy and maintenance treatment, many of the patients relapse and became primary, secondary or tertiary platinum resistant. So what we do with these patients? So if you have a patient in the relapse setting, you can re-challenge everything. So you can do surgery after surgery, chemo after chemo, PARP after PARP, angiogenesis after angiogenesis, but the effect is always weaker. This is what I title the phenomenon of shadow. So we can repeat everything, but you need modification. And TTFields is a very attractive approach what is already introduced in patients with brain tumors with glioblastoma. It's already introduced in mesothelioma. And what I like to see, if we can use these TTFields, what have a strong impact on repair mechanism, on the proliferation, on the metastasizing of the tumor cells in many solid tumors and even in preclinical studies, to bring this to ovarian cancer. And we just have finished the phase 3 trial, the Innovate trial, by our European network of clinical trial groups, the ENGOT, and has failed his primary endpoint overall survival, but I'm very optimistic to find specific groups who may benefit better to introduce TTFields in combination with Paclitaxel weekly chemotherapy, because platinum resistance is not anymore a homogeneous cohort, so we have to split to look in detail on different pre-treatments, but even maybe after the TTFields as a maintenance approach, what happened later. So this is something what I believe to change the system of treatment in cancer, not to use always the same weapons, to modify, to repeat something, but with a modification. And I think that TTFields is a very promising approach, and even glioblastoma, without knowing too much about these brain tumors, is not an easy disease. So let's use it for women health and try to incorporate this in women cancer.